They say it takes a village to raise a child. This saying has been especially true for us in the community care sector. Since the onset of COVID-19, the sector has banded together to care for our clients and lend our support to one another.
At that time, the number of cases in the community was rising pretty fast. So there was always a concern that the number will overwhelm our healthcare system. When the nursing homes started to get affected, we were the first, but we knew that others will follow suit. We realized that that number is going to overwhelm or even break the system. So when Heidi and Shu Ying called us and said that do we want to be the first to try out the care and nursing home program, where we look after our own patients, it was the right thing to do at that time. We knew our patients. Our patients had dementia and psychiatric issues. They will not be easy to be managed at outside facilities by strangers. Credit goes to my management. They were very fast with their response. And of course, the most important reason was the AIC CERT team. They gave us so much confidence and support. It was amazing, especially the initial stages. And they had it all planned out. We knew what we needed. MOH and AIC had been preparing us for this for a long time, 2 years in fact. So our PPE stands, the AIC's regular advisories, and AIC conducted many walkabouts in the nursing home. The initial challenge was space. We had to create wards for the COVID patients, and since this was like a breakout, we had a large number, we had to create massive wards. And the staff and the management were very, very helpful. The second wave, this Omicron wasn't so bad with some of our staff. They were very well, but they were positive. So they couldn't come to work, but they were well. So we were thinking whether they could come and look after our COVID positive residents. When we ran it through Shu Ying and Heidi, they were very excited about it, and they thought it was something that we could try. And they actually went back to their bosses, and then I think MOH and NCID and Tan Tock Seng doctors all came together and they said, actually it might work.
The AIC COVID-19 Incident Response Team was actually set up to provide ComCare partners with prompt support and practical guidance when managing a COVID-19 incident in their homes. For Sunlove's case, together with advisors, we worked very closely with them on the management of cases, and we also provided clarifications on new measures to be implemented, testing protocols, as well as conveyance and contact tracing methods during the enhanced surveillance period. We had earlier envisioned for nursing homes to slowly transit to caring for their residents on site. To be honest, this came quicker than we expected. When the number of recovered cases finally surpassed the number of infected cases for the very first time within the day, we were quite hopeful of what is to come. We all felt like immense proudness when we saw the final resident graduated under their care. And this was also a huge milestone for us, as seeing Sunlove pull this off gave us the confidence that the success model can be replicated in other nursing homes as well.
As an example of a challenge we encountered, we had to try all ways to work around the issue without taxing the resources further. To this end, we put resources from our hospital geriatricians to assist us in the process. the value of a pre-existing partnership and relationship between the resident physician and nursing staff and administrators of the nursing home. This allowed for a fast and efficient coordination to make care at nursing home work with such short notice. I'm actually very grateful to NCID and the regional hospitals in coming on site to help assess the suitability and to give us valuable advice for our care at nursing home.
So in that particular nursing home, we did quite a lot of things. We had to do the infection control, we had to do the swabbing of the residents. Because that was the very first nursing home, we even had to care for the nursing homes on site. Then subsequently, most of our work gravitated towards just infection prevention and control. Most of the synergies were built way beforehand. We have been involved with the nursing home for more than 10 years in various ways. This allowed us to build trust with the staff, with the management of the nursing homes. They knew that we were always around for them.
Before the care at NH started, NCID was already involved in the nursing homes for testing capacity. So when care at NH started, the main issues that we needed to address were twofold. Number one is, how do we prevent transmission of the COVID virus among residents in the nursing homes? Because now the patients are going to be managed there and then. Number two is, how do we manage COVID patients in nursing home itself? The nursing home partners were already quite familiar with COVID management, but the only difference was now they're going to be managing the COVID patients in situ for a longer period of time, and that may have caused some anxiety. So what we did was we informed them of infection control practices, latest in the guidelines, and also clinical care practices, and imparted that knowledge and sort of gave them the confidence that they are actually already ready to care for these patients. So if you may, we were more like confidence boosters for the nursing home partners. The important measures included ventilation. Because SARS-CoV-2 is an airborne virus, so we needed to make sure that the ventilation in the nursing home is adequate to minimize transmissions. So we worked with the nursing home to assess the different setup of the nursing home. We walked the ground with the nursing homes, AIC, MOH and all, to see what are the different settings and how are they ventilated. And we designed the principles on where to place the air purifiers, which windows we should open, etc. And also when to transfer them out of the nursing homes or community treatment facilities if required.
This is only a glimpse of what the community care sector can achieve together. To the amazing partners who have enabled us to carry out our mission every step of the way, thank you.